A new uptick in COVID cases has raised concern, especially with school starting. We get details from Dr. Jeffrey Kahn, an infectious disease specialist at Children's Health. Good morning, Dr. Kahn. Good to see you.
Good morning.
I've seen a couple new strains of the COVID virus being mentioned all across the country. What are we seeing locally here in North Texas, and how much of a spike are we really talking about?
Well, we certainly have seen an increase in the number of cases and the percentage of tests that are turned positive for COVID. I think the important thing to note is that these numbers are still far lower than they were a year ago or during the peak of the Omicron spread. So I think the message is that if you're particularly prone to COVID, if you have an underlying medical condition that puts you at risk for severe disease, that certainly you should get vaccinated and you should take precautions right now.
All right, kids back in school. And as I know, with a 10 and 6-year-old, that usually comes with the passing of colds and viruses. And I saw in Kentucky, there was actually one district that said nearly 1/5 of its 900 students either had COVID, flu, strep within the first week and a half of school. In fact, they had to close school. How is a parent to know what our kids have, and how do we make sure we don't see like a spike like that here?
Well, as you mentioned, schools and particularly daycare centers are really breeding grounds for viruses and bacteria. And of course, we've known that way before COVID. And I think it's important for parents to recognize, or to, at least to keep in touch with the local trends. We're not quite seeing what was experienced in Kentucky right now, but it's important to keep an eye on that. And also to take the necessary precautions. If your children have not been immunized, go get them immunized. If your child is particularly at risk for severe COVID or flu or RSV, then you may want to take precautions such as giving them a mask to wear. So we just have to be aware of what's circulating outside.
Yeah, I actually stuck like one of the little, sanitizing bottles in my little guy's lunch, because I'm like, please put some of this on before you eat, or wash your hands before you eat. You keep mentioning those with weakened immune systems. I mean, when it comes to flu and COVID vaccines, do we know yet? Because I know, like with the flu strain, we never really know what kind of strain it's going to be, if the vaccine's going to totally cover it. Do we know this go round how much those vaccines are going to protect?
Well, we're all waiting for the new COVID vaccine to come out, and hopefully it will come out sometime in the fall.
Okay.
And this COVID vaccine is really geared towards the Omicron and the subvariants from Omicron. So I think that at least the impression is that this will be a very, very effective vaccine. Yes, we're always up against new variants emerging. And flu is a classic example of that sometimes the vaccine doesn't quite match the strains that are circulating. But there's certainly a lot of anticipation that the new COVID vaccine will work against the EG5 virus, or the RS virus that's circulating now, and many of the other variants, because they're all descendants of the Omicron lineage.
All right, keeping an eye on it. Thank you so much, Dr. Kahn.